Welcome to this very special edition of the KJ Masterclass Live, the show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And today we have Brett Cords. He's a recently retired ear, nose, and throat physician and surgeon who is now launching his own private physician coaching business. We'll learn from him about his powerful journey from surgeon to recovery and how he now coaches physicians battling burnout and substance abuse. Welcome to the show, Brett.
Thank you for having me. I'm glad to be here.
You are welcome. Welcome to the show. Welcome to India in this online form, Brett. And I'm sure not just in India, but a lot of people across the globe will benefit from what we are going to talk right now. We'll learn about your story. We'll learn about how you overcame addiction and now how you are helping physicians heal others. In this backdrop, we'll have our conversation. But before that, let's understand a bit more about you, your story, your journey, your background, so that people know who they are listening to.
Okay. Well, like you said in the intro, I'm a recently retired ear, nose, and throat physician. I'm 48 years old. So I worked as a practicing physician for about 16 years. And, you know, I had really mostly a normal, average upbringing. I grew up in Louisiana, which is in the United States. And when I was in college, I really had no idea what I wanted to do. I had not always wanted to be a doctor. In fact, everyone in my family are either teachers or lawyers, but there are no doctors, there are no nurses, there are no healthcare providers at all. So I had no idea what I wanted to do when I went to college. And it was only because I was diagnosed with cancer of the lymph nodes, lymphoma, after my freshman year of college, that ultimately made me want to go to medical school and become a physician. So it was my own personal experience with cancer that caused me to eventually become a physician. And that was also when I was first introduced to opiates, which are painkillers, which is eventually what I became addicted to later in my career. So lymphoma was not a very painful cancer, but I had, you know, biopsies and different procedures that required pain medication. And back then I realized that I liked that pain medication, but it wasn't an earth-shattering feeling. You know, I didn't have that euphoric feeling that you sometimes hear about a drug addict experiencing the first time they try their drug of choice. But that's because everything was going, you know, well in my life at the time. Fast forward, you know, 18, 20 years, and I've been working as a physician inside the Texas Medical Center for about 5 years when I started to experience some anxiety and a little bit of depression. And honestly, I started to feel like I was bored. But in retrospect, you know, I figured this out much later, that really what I was experiencing was a lack of fulfillment. It wasn't necessarily boredom per se, because I had been climbing the mountain my entire life. You know, high school and then college and then medical school and then surgical training and then ear, nose, and throat and head and neck surgical training. 5 years of practice to build up my patient base. And I was 32 years old before I started working and received my first paycheck. So I kind of looked around and my first thought was, instead of relaxing and enjoying the process, my first thought was, what's the next challenge? And so that anxiety eventually led me to trying opiates. And, you know, I tried a cough medicine sample one Friday afternoon that had hydrocodone in it. And eventually that led to a 6-year progressing history of drug addiction. And so lost my job in 2019, had to go to rehabilitation for 3 months. And I've been clean and sober from opiates ever since. Took me 3.5 years to get back to work because there's a lot of hoops that I had to jump through and red tape that I had to cut through to prove that I was a safe physician for patient care again. But after 3.5 years of recovery, I went back to work, and I realized that although I liked clinical medicine, I didn't love it anymore. I had lost my passion for clinical medicine. And so life coach, the subject of life coaching came up between myself and a former colleague. And I trained to be a life coach, and now I'm a physician coach to other doctors who are experiencing symptoms of burnout, which may or may not include substance abuse. So that's my story in a nutshell, and here we are.
Here we are. But I want to understand, you have a working mind, you are a doctor, you know about things, and how did, one can take some pain medicine and then can, but beyond that, a continuous use of something, why didn't you stop yourself using the mind with which you treated your patients? Because you had that. Why? I just want to understand your mind at that point in time.
Yeah. Well, you're asking what a mind and how a mind works when it's in active addiction. And so I'll explain it like this. When you're in active addiction, your brain is sick. So you're trying to fix a sick brain with the same sick brain. So it's like trying to fix a broken elbow with the same broken elbow. It doesn't work.
Okay. And then, didn't you ever try to fix yourself in with not that, but something else, until you came to a position where you had to, leave your the thing that you loved so much at that point in time? And
Yeah.
how did it occur? Because even if you go into rehabilitation, your mind works to go back into the same situation. I want to understand that part. Then how did you realize, okay, now I have to move out of this, and you need to get back your license?
Yeah. So the answer is yes. I tried to fix myself. I tried to stop taking the pain medication several times during those 5 or 6 years when I was in active addiction. But my brain would not let me give them up on my own. I couldn't do it by myself. I did try several times. And so one of the tricks, one of the realities of drug addiction is that taking the substance, that's the easy part to give up. So, for example, if you don't have access to drugs or alcohol, then obviously you can't be a drug addict or an alcoholic. However, the brain problem remains. There's a reason why you're taking those drugs, right? There's a feeling that you're trying to numb, or there's an emotion that you're trying to avoid, which is why a drug addict takes drugs. Unless you can learn how to appropriately cope with that feeling, and unless you can learn responsible stress management skills to deal with that negative feeling, you're never gonna fix the addiction. So it's twofold. It's stopping the actual physical taking of the medication, but you also have to instill proper coping skills, which I lacked. I didn't have the coping skills to deal with the lack of fulfillment and the anxiety and the depression. I had to develop those coping skills in rehab in order to later fall back on, so that I didn't need those drugs anymore. And so rehab is 3 months long. It is said to take about 3 months to fully develop a new routine and a new habit. I'm not sure how true that is, but I'm not sure I could have gotten better in any less than 3 months. I can tell you that.
Absolutely. When did you start taking back control of your life? Was it your action first, or was it your thought first? How did that start happening? A lot of people go into rehab, but that does not mean that they take their control back of their life. But in your case, you did, and now you are progressing. You left that thing. Now you are into coaching and all. I want to understand that for the audience.
Yeah, boy, that's a great question. Which came first, the thought or the action? That is a great question. I would have to say that the thought came first, which is particularly interesting because my coaching theory, the coaching style that I use is built on the idea that our thoughts control our feelings and our emotions, and our feelings and our emotions control our actions and our inactions. So for me, when I was in rehab, the thought changed that I wanted a better life, that I wanted to learn how to live life on life terms without these pain medications. And eventually the action followed that. But it was by far the most difficult thing I've ever done. I had mentioned before that I fought cancer for a year and a half when I was 19 and 20 years old. But fighting addiction is, for me, much, much more difficult than fighting cancer ever was. And so the short answer of how does one do this is one day at a time. And sometimes you even have to break it down into 1 hour at a time. And sometimes it's so difficult on bad days, it's all you can do to just simply do the next right thing. Get out of bed, brush my teeth, make my bed. Sometimes you have to break life into 5-minute segments. Those are the bad days. But I've been in recovery now for over 5 years from opiates. And I still have bad days, but they're few and far between. So thought came first, action followed. And now, my goal is to help other physicians who are struggling.
When you look back at your life as a physician, especially when you were addicted to these things, how would you like others to learn from your journey, from that part? Not all physicians are addicted, maybe a few here and there, I don't know about that. But for general people who get addicted to things and think there is no way out, what is it that you want to tell them? What is it that they can learn from you? What is it that they can action themselves in their life so that they take back control of their lives? Yeah. How would you like to put it for them?
Well, the first thing I'd like to tell those people is that they're not alone, and that drug addicts are not always the stereotypical homeless person or the hobo on the side of the road or the person at the street light that's begging for change. I was a surgeon and a doctor in the Texas Medical Center, which is the largest medical center in the world. And I was performing roughly 400 surgeries per year. And I had every advantage that you could possibly have in life. And I became addicted to painkillers. And so if someone with all of the blessings and advantages in life can become addicted like myself, then anyone can become addicted. So there's no reason to feel shame or guilt if you're struggling with drug addiction. And then I'll follow that up by saying, if I can get better, and if anyone can get better, then so can the listener. If there's a listener out there who's struggling with drug addiction or alcoholism, I guarantee you that it is within their potential to get better. You just have to want to get better, and then you have to ask for help.
Ask for help where? Rehabilitation center, or there are other options available, Brett?
Yeah, there are other options. Rehabilitation centers, in my opinion, are the best option, but some people don't have the means to do that. So there are various 12-step programs, Alcoholics Anonymous, Narcotics Anonymous, Cocaine Anonymous, and those are free of charge. So there is something out there for anyone. At the very least, I would look up the nearest AA meeting, Alcoholics Anonymous meeting, and go to a meeting and see what it's all about.
Absolutely. And once you were out of that situation, what thought led you to, get back your medical license? Was it more about livelihood, or was it more about, redemption, if I may call it, or what was it? How did you look at that?
Well, in the United States, once the Texas Medical Board finds out, they have to see documentation that you completed a 90-day rehabilitation treatment plan. They drug test you once a week. And so there's a lot of logistics involved, a lot of ones and zeros and black and white documentation. But the real question you're asking is, yes, it was a story of redemption, because I had really hit rock bottom. I had got fired from my job. No one would hire me. And it was all over the internet. In my town, everyone knew what had happened. Everyone knew that I was a drug addict and I'd lost my job. So it was very difficult in those first few months and even a couple of years. But eventually I turned that rock bottom into progress, which eventually led to a redemptive recovery. And so, again, one day at a time, and believing in myself, believing that I could do it.
Did anyone ever tell you that you, Brett, you operated on me and that I didn't know that you were taking this addictive drugs at that point in time? Did all went very well all through your surgeries, in spite of having all those things? Did that load ever come onto your head, that okay, this is what I could have done better if I had not taken it, or by God's grace everything went well during your career?
Yeah, by God's grace everything went well, which is not uncommon for physicians and surgeons. Even physicians and surgeons who are in active addiction, everything in their life starts to crumble and struggle. Their personal lives, their relationship with their kids and their spouse and their colleagues, their physical health, their mental health, all of that deteriorates. The very, very last thing that is affected is direct patient care. So by God's grace, my direct patient care did not suffer. There were no mistakes. There were no untoward results from my drug addiction. But again, that's luck and God's grace.
Absolutely. What about your emotional journey? You see, you as a surgeon, as a doctor, you are with everyone. But when you are fighting for something as this one, regaining your medical license, perhaps you are all alone. And it can be a tumultuous emotional journey. How was it in your case, Brett? Was it easy, very emotional? Where did you find support? Did you find any support at all?
I did find support. And to answer your question, it was the hardest thing I ever did in my life, because not only was I isolated from my colleagues, but COVID hit in the middle of this. So I was fighting through addiction recovery and trying to be clean and sober, in addition to the COVID isolation that we all experienced. So it was the hardest time in my life by far. And again, I did have the support of my family, my spouse and my kids and my parents. I did have that support, but it was very difficult. Ultimately, I had to find a lot of strength within myself, and then also lean on my close family members. But it was very, very difficult, and I almost gave up more than once.
What about support from the medical fraternity?
No. In the United States, it's also private, that very few people knew exactly where I was in my recovery journey. And the ones that did know, to be quite honest with you, did not want to help or be associated with me. So that was a big difference between addiction and fighting cancer. When I had cancer, everybody sent well wishes. Everybody put me on prayer lists. Everybody gave me support. With addiction, it was almost the opposite. So unfortunately, in the medical field, addiction is still a very taboo subject, and not something that's widely talked about.
But why, Brett? Same doctors would treat a patient differently. Patient who is addicted and having problems there. But same doctors will not be compassionate towards their own colleague. Why is it that? Do they fear for their own careers? Is it like that? Or don't they understand these things better? Do doctors need to understand addiction better first?
Well, the reason is because all of us understand things on two different levels. You know, you can understand something on the mental or intellectual level, and then you can understand it on the emotional level. And all physicians understand addiction on the mental level. But when it comes to emotions, I think a large percentage of physicians, if you really ask them deep down, they still consider addiction a choice, and a bad choice at that. So even though their brain and their intellect is telling them that this is a disease, and the addict, in case me, deserves respect and deserves support, emotionally they're not there yet.
How was it when you rejoined your medical profession after getting back your license?
Yeah, it was tough. It had been 4 years since I had operated and since I had worked as a functioning physician. But I'll be honest with you, it was a little bit like riding a bike. Those skills came back very quickly, and I did have an awful lot of support when I came back to work. I do want to highlight that. I was humbled and extremely grateful for the support that I received when I eventually and finally made it back to work.
And getting back your license, getting back to doing what you knew, being a surgeon, in this whole journey of yours, Brett, what did you come to know about yourself that you did not know earlier on?
Yeah, boy, that's a good question. I would have to say that what I learned about myself is that I had the capacity to humble myself. I had the capacity for humility, because in my opinion, humility and the lack of ego is the single most important virtue in my recovery from addiction. And so I was surprised to find that I had the capacity for humility, because for most of my life I was living with a pretty large ego, a decent amount of grandiosity. So but only through the help of others, with the help of my higher power, was I able to tap into that humility and eventually kind of grasp and massage this successful recovery.
And then one fine morning, you found that you did not love it as much as you did earlier on. And that is something much more bigger for you to achieve.
That's right. That's right. And so now, substance abuse, addiction, alcoholism is a part in a lot of people's burnout, but not everyone. And I'm here to help all physicians that are dealing with burnout to get back to what they used to love.
Right. And how is this life vis-a-vis the earlier life? Do you miss that, or are you looking at much more looking forward to this new life?
Oh yeah, I'm enjoying the new life a lot better, and the difference is that now I'm able to enjoy the present. I'm able to enjoy the current times. I'm not looking in the future. I'm not looking and worrying about the past. I'm living in the present. And so that's the biggest difference, and that's the best gift of all of them.
And maybe your coaching is now, it can be available to anyone in the world. Is that like that, or is it only about US citizens?
Oh no, absolutely not. I would coach anyone in the world. My handle is theburnoutdoc.com. So if you can make it to that website, we can work together.
Absolutely. Absolutely. In a nutshell, now, if you look at your life, past and future, what is it that you seek for yourself now, Brett?
Well, I'd like to see, several physicians that would have either quit medicine or would have retired early or would have gotten deeper into substance abuse, come through it successfully, treat the symptoms of burnout, and then go on to have a prosperous and illustrious career the way that they always envisioned. And then as for me, help as many physicians as I can, enjoy the present, and then enjoy a second retirement, maybe in 20 years.
Absolutely. There's much to learn and understand about your journey, about you, about your recovery process, about your redemption, and for those people who want to get your coaching. So what's the best way for them to connect with you, Brett?
Best way to connect with me is, on the internet. You can just Google theburnoutdoc.com. I'm also on Facebook. I'm on Instagram, LinkedIn, YouTube. So all of those are the Burnout Doc.
Wonderful. With this, it's a wrap on this very special edition of the KAJ Masterclass Live. Thank you so much indeed for joining us.
All righty. Thank you for having me.